Hi everyone, how will you draw brachial plexus during examination? Now you should draw actually the nerve root, that is the C5, C6, C7, C8 and T1. So all these nerve root unite and forms the trunk of the brachial plexus. Now the upper one, the two nerves, they unite and form a trunk, that is the upper trunk of the brachial plexus. The C7, it comes out as a middle trunk. Itself it forms the trunk. So this is the middle trunk. This is the upper trunk, this is the middle trunk. Now the C8 and the T1, they unite and forms the lower trunk of the brachial plexus. Now this trunk divides into two. One is anterior division, another is the posterior division. So you will see it divides into two. The anterior division, these are the anterior division of the nerve. And the posterior division you will get here, these are the posterior division. Again this division, the anterior division, they upper two unite and forms the lateral cord of brachial plexus. Next, this lower trunk, the anterior division, forms the medial cord of the brachial plexus. And union of these three trunk, the posterior one, posterior division, it forms the posterior cord of the brachial plexus. The name of the cord is, it lies behind the axillary artery, that is the posterior cord, which lies lateral to the axillary artery, that is known as the lateral cord, and which lies medial to the axillary artery, that is the medial cord. So this is the lateral cord, this is the medial cord, and this is the posterior cord of the brachial plexus. Now this cord and the trunk you will get in the axilla, and the roots and part of the trunk you will get in the posterior triangle of the neck. Now what are the branches of this cord? Now from the lateral cord there is arising of the lateral pectoral nerve, the lateral root of the median nerve. There is another, that is the musculocutaneous nerve. From the posterior cord, there is branching there the upper subscapular, lower subscapular, thoracodorsal, and there are main two nerves, that is one is axillary, that winds the surgical neck of the humerus, and another is the radial nerve, which supplies the extensor muscle of the arm and the forearm. Now from the medial cord, the branches are median root of the median nerve, and you will get medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and you will get the ulnar nerve, which is the nerve which supplies the forearm muscle as well as in the palm. So this is the brachial plexus drawing, and sometimes you have to know that what is Erb's palsy. Now Erb's palsy means the junction between C5 and C6 and the division, that is the upper and the lower division. And there is arising of the two nerves, that is the one is known as the nerve to subclavius and suprascapular nerve. Together the six nerves form a point, and this point is known as the Ups point. So if there is injury here during bad delivery or from the fall from a tree, there is Ups paralysis. So this is how we will draw the brachial plexus. Now in some question it has been asked separately to draw the Ups point. So how we will draw the Ups point? You will do this, that is the C5, C6, they unite, it forms the upper trunk, and here there is the division. One is the anterior division, another is the posterior division. And this is the subclavius, nerve to subclavius, and this is the suprascapular nerve. So junction of this point is known as the Ups point. Thank you everyone.